guys, you ready in the studio?
Yep.
Ready? 3, 2, 1. Hey everybody, I'm Tiffany Smith and you're listening to Let's Talk About It. We're talking about some of the most important health questions that young women have, and with me today, we're very lucky to have Dr. Lauren Streicher, who's a gynecologist and an expert in this field. She's going to help us hash some of this out. So thank you so much for being here, Dr. Streicher.
Thanks for having me, Tiffany.
This week, I hit the streets to find out what was on women's minds. Let's take a look at the video. Hey, on my show, Let's Talk About It, we are talking to ladies on the street to find out what questions they have about their health. So what's something that you want to know more about?
You know, I want to know what exactly is a pap smear and what is it testing for?
That's a great question.
Well, a pap test is also called a pap smear. There's a lot of misconception about pap tests because many women think it checks for everything, that a pap test is going to tell them if they have ovarian cancer, uterine cancer, sexually transmitted diseases, but that's not the case. Basically, all that a pap test checks for is abnormal cells in the cervix, either precancerous or cancerous cells that are a result of infection with an HPV virus. Now, it sounds really scary to have a pap smear, but for people who haven't had one, it's really not a big deal. I use an instrument called a speculum, and basically I put this small speculum in the vagina so that I can see the cervix, sample cells from the surface of the cervix, and then I send those cells off to the lab where they can see if there's any precancerous or cancerous cells. And that way, even though most pap smears are normal, if there are some abnormal changes, we can see if any further treatment is necessary.
And what do you do if you get that call that says your pap test is irregular?
Well, the first thing is don't panic. This is incredibly common. Every year, 3.5 million women get that stomach-dropping phone call or letter, and the overwhelming majority have absolutely nothing serious wrong with their cervix. But what that means is that we need to do some further testing to see if there's any precancerous or cancerous cells caused by changes from the HPV virus, because these changes can be treated so that it doesn't progress on to become a true invasive cervical cancer. We know that if women get regular pap tests and go to their gynecologist, that we can prevent it and treat it. So you got to talk to your doctor to get all the information so you know really everything that you can do to prevent getting this virus.
That pap test is incredibly important. Thank you so much for being here with us, Dr. Streicher, and sharing all this great information. And thank you guys for listening. If you want to find out more, just talk to your gynecologist. That's it for this episode of Let's Talk About It. I'm Tiffany Smith. Until next time.